Today, the CDC is out with an urgent warning for anyone who's pregnant or plans to have a baby, urging them to get vaccinated against the coronavirus. ABC's Rena Roy shows us why.
Samantha Kelly is now recovering after ending up in a coma fighting COVID-19 at 32 weeks pregnant and unvaccinated.
I should have gotten that vaccine. I hope every pregnant woman gets it.
That's the same message from CDC officials who warn expecting moms are twice as likely to end up in the ICU and 70% more likely to die.
They've looked at these numbers. The numbers are not good. That's the reason they're out with this urgent health alert here. And it really comes down to risk versus benefit.
The urgent plea comes as new vaccine mandates go into effect across the country. Some, like Leah Peterson, fighting back against Oregon's vaccine requirement for healthcare workers. Her request for a religious exemption was denied.
You're taking an already understaffed medical staff into a worse situation, which will directly affect patient care.
Experts say more vaccinated Americans means more protection for our nation's most vulnerable, like children. Ohio has the second highest total of pediatric cases in the entire country.
We're seeing an increase in our census that's been astronomical, so pretty hard to keep our heads above water day in and day out.
A new study from the University of Oxford found more than 1/3 of COVID patients had at least one symptom 3 to 6 months later. We talk a lot about long-haul COVID. Some of the most common symptoms include breathlessness, fatigue, abdominal pain, depression, and anxiety, lasting effects from COVID. Coronavirus testing positivity rates on both sides of the state line are still falling right now. In Kansas, 8.4% of tests are coming back positive. That number was above 10% at the start of this month. The Missouri rate is now 8.9%. You see this chart here. It's the lowest that we've seen in nearly 9 weeks. As positive tests and hospitalizations trend downward, health experts are encouraged, but preparing for what comes next. Doctors with the University of Kansas Health System say they fully expect another surge in coronavirus cases soon.
Things get better. We take masks off. People start going indoors as the cold weather comes. It's going to be rainy and wet the next few days, and you can see the cool weather coming in. Schools start getting together. They take masks off. After school activities. Do we think we'll see another wave, Hawkeye? I would bet on another wave.
Doctors say now is the best time for people who haven't gotten their shots to get vaccinated. They also recommend masking in indoor public spaces to keep the numbers low. The health system is treating 62 COVID patients right now. 28 patients have what are called active infections. 8 of those are in the ICU. 7 of those patients are using ventilators to breathe right now. The Kansas City VA now offers Pfizer booster shots to eligible veterans, their spouses, and caregivers. Booster is recommended for people 65 and up and those 50 to 64 with underlying medical conditions. The shot is also available to other adults with underlying health issues, people who have a higher risk of being exposed to or spreading the coronavirus as well. In Wyandotte County, Pfizer's coronavirus booster vaccine is now available for people who qualify. There's a free clinic at the old Kmart building near 78th and State Avenue. It runs from 10 to 6 today and tomorrow. Go online, visit vaccines.gov for more information. A reminder, if you weren't vaccinated with the Pfizer vaccine, you should not get a Pfizer booster.